Hello everyone, welcome to week 3. This week our chapters are divided into 2 PowerPoints, so we will start with PowerPoint 3A, which covers chapters 19 to 23. So in chapter 19, we start with an introduction of the role of the nervous system and the functions of the cells that make up the nervous system. It's important that you understand what movements and activities are controlled by your nervous system. It's very important that you also understand the physiology, the main physiology, working from the dendrites up the axon. You won't have any questions specifically identifying areas on the neuron, but it's important that you understand their function and what they do. It is very important that you take time to understand the movement of electrolytes within the action, and mostly the sodium and potassium. You should be able to draw this, explain this, and have a strong understanding. So that might be, if you're a flashcard person, worth making a flashcard and practice explaining it to your roommate, to your dog, whoever wants to listen, so you are very familiar. Within the nervous system, it's important to understand the different parts of the brain, the anatomy. So know what the hindbrain, the midbrain, and the limbic system, the forebrain do within the function of the central nervous system. Chapter 20, we start getting into anxiolytic and hypnotic drugs. These may be something that are very new and unfamiliar, so take your time and remember that the overall safety and nursing points are very important, if not more important, than understanding each specific drug and how it works. Within those categories, similar to antibiotics, it's important that you understand the pharmacokinetics of the main groups. So for benzos, you need to understand the main adverse effects and precautions and nursing interactions. You don't need to know necessarily the difference between the benzos. Same with barbiturates. You need to know what the drugs do and their contraindications, but you don't need to identify any specific ones. Chapter 21, we get into antidepressants. So becoming familiar with the signs and symptoms of depression is important. There are many tools that you will see in your workplaces. They vary depending on the type of care. So we won't cover those specifically, but it's important to know the actions of antidepressant therapy and the different classifications. There's a few different types. Your tricyclics, your MAOs, your SSRIs. So you should know the difference between those 3 medications and know the contraindications to discontinuing those, the risk for patients, and the most important teaching points for your patients. It's also important to know any main drug interactions and things you should be looking at. There's a list of other antidepressants at the end of the slide. Don't take time memorizing those. It's just good to sort of take some time looking at the different options that are out there. Chapter 32 goes into the psychotherapeutic agents. Again, this is probably something that's new to you that is not covered in your prior courses, but you will see more of them in your psychology nursing courses, and of course if you go into that field. So take some time understanding this is just touching the surface on schizophrenia, bipolar, narcolepsy, just giving you a couple lines that you should know, that you're able to understand just a basic of those disease processes, and then how the medications work within them. The last chapter in this first section of week 3 is chapter 23, anti-seizure agents. This is a type of medication where it's important that we go back to our understanding of half-life. Some seizure agents have a very long half-life, and it's important to know that, as well as monitoring that's required for drugs that are treating seizures or acting as preventive for future seizures once a patient has been captured. So take some time to understand those different categories and the main nursing considerations and questions that you should be asking your patients. If you flip over to your second PowerPoint for week 3, you'll see it covers chapters 24 to 28 and starts off with anti-Parkinson agents. It's important to understand the basic of Parkinson's disease, so it starts off by giving a good description of that and the goals for treating Parkinson's and sort of the tiers of how treatment can look. The next chapter, chapter 25, goes into muscle relaxants and the different types of reflexes that muscle relaxants can act on, both the simple and the complex, and the pathways of the impulses that are impacted. Again, it is not important for you to know the certain drugs, but just focus on the types of muscle relaxants that there are and the safe nursing considerations that you have to consider for your patients. Chapter 26 goes into narcotics, narcotic antagonists, and anti-migraine agents. This is likely something that you have seen in the media, you may have experienced in your personal life, and all of the different ways that healthcare is changing with control of narcotics. So in this chapter, they start by just describing the definition of pain, the gate control theory, pain receptors, and how they work. So we will spend some time in this chapter getting to know the different types of narcotics. It's important for you to know especially what counteracts those narcotics. So that is something that you should know to be a safe nurse. So do take some time to make a couple flashcards for that. Chapter 27 goes into general and local anesthetic agents. We will breeze through this more or less. It's important to know the basic parts of anesthesia, but unless you're pre-op, post-op, or in the OR, this is more for really very specific fields of nursing that you'll be trained on. So it's important to know if you have a patient who's been recently under anesthesia, things to look out for, but don't take too much time obsessing and learning about this specific chapter. Chapter 28, the neuromuscular junction blocking agents. Similarly, this is pretty specific, so take time reading the chapter, of course, but don't spend nearly as much time on this as you have on some of your prior chapters, such as antibiotics. This week you will have your second discussion board. Take time reading through the 2 scenarios and choosing which one you would like to respond to. Remember that for either one that you decide, you need to be putting things into your own words. Most importantly, in the second scenario, Juan Carlos, the 8-year-old with the diagnosis of attention deficit disorder, I'm sure there are many teaching plans out there that you could simply download and upload to the discussion board, but that's not the main goal. So take time to think through what you would say to a patient and their family and what you could develop for a teaching plan for them, using your references, but not simply taking something that has already been developed. This week you also have 2 virtual simulations. Hopefully you are warmed up from your first one with Harry Hadley, and these ones should go pretty smoothly for you. Remember to choose one set of reflection questions to submit your reflection on whichever one was more meaningful or more challenging for you, and take time reflecting on why. During this week, I encourage you to look back through your first 2 weeks, review what you felt prepared for or unprepared for on your quiz, and start getting organized because your midterm will be next week and it will come up quickly. So hopefully you're able to create a study guide or a set of information that you know you need to learn for your midterm, and you can be ready next week to just review that and the material from the first 3 weeks. Keep it up.